Breastfeeding Insights, my experience and discussions with healthcare workers in Ghana. So first I'm going to talk about my personal breastfeeding experience as somebody who grew up in a different culture and then coming into the US and having my first child at the time. And then talk about some of the breastfeeding experience I have working with healthcare workers in Ghana. And then I'll talk a little bit about just breastfeeding practice in Ghana, stakeholders and policies, and some of the lessons that I've learned over the years. So as a first-time mom, hold on here. As a first-time mother, you know, I'm married to a physician. We had our first baby. We thought we had the whole breastfeeding thing in a bag. I grew up seeing my mother breastfeed her kids, you know, so watching somebody breastfeed is totally different from you doing it yourself. Just the change in birth plans and expectations were so different. I went through that whole experience with where my mother and baby were separated for a little bit, and then going through my breastfeeding difficulties like poor latch, nipple trauma, delayed milk supply, had a jaundice baby, engorgement, and how to deal with all that. And I contrast that with my sister's experience, because my sister had given birth in Ghana like a week earlier, and she had her whole village around her to support her with breastfeeding. So my mom is there, my aunties are there. And so her entire breastfeeding experience was different from mine. And she will call to check on how things were going. And, you know, sometimes I was like, I don't know that I even want to talk about this right now. But then it was just a different experience. But I think, you know, having a supportive husband was helpful, but also it sets the pace and kind of gave me an idea of what a first-time mom goes through without having a village. And I think it changed the way I practice medicine after that. So looking back in the last 14 years, I've been working with mother-baby diets. As a pediatrician, you see babies in the hospital and then also in the clinic, and breastfeeding issues come up, and sometimes you have to help them to navigate that. So doing that in rural Missouri, providing comprehensive care for, you know, the 10, 12 years, and then here in Virginia, working in the hospital and working in a breastfeeding clinic, and then working with moms and babies as well. So with that background, in 2014, I started doing newborn health education workshops in Ghana. And then I had the opportunity to go through Helping Babies Survive training in 2015. So 2016, I started incorporating Helping Babies Breathe and then Helping Babies Survive. And a big part of that program is essential newborn care, which breastfeeding was part of it. That experience offered me the opportunity to interact with over 400 healthcare workers in the last, you know, since 2016, and working in both public and private health facilities, setting up these workshops and facilitating them. But it also meant that I came into contact with a lot of midwives and nurses, occasionally some physicians that were involved in newborn care. So in this picture, what you can see, this actually the first picture with me touching the baby and the mom, which all these pictures are with permission from them, is my most recent training that I had, which was part of newborn education. There were about 150 participants. And then after that, we had the opportunity to interact with a mom and a late preterm baby. And what you can see in the picture is that I had actually watched her breastfeed her baby. And we kind of went through some of the things that she could help to improve latch and things like that. And I felt so happy that I was able to contribute to that, because I look at my journey where I started from and just how much I've learned in the process, especially now practicing more breastfeeding medicine. The next picture, besides that, is actually one of the trainings that we held like a couple of years ago. And then one of the participants being so excited about the possibility of, you know, breastfeeding a baby and wanting to try it out. And so that was an interesting take on that too. And then this one is actually a midwife. She wanted me to take the picture to show how supportive the culture that she's in So this was in a training workshop, and she brought her baby. The baby needed to breastfeed, and she just breastfed, and it was totally normal to her. And then the next one is just some of the other healthcare workers that were there, mostly midwives and community health nurses. But one had a baby that the baby eventually fell asleep. And so I just picked the baby so the mom could focus on the training. And then there was a lot of role playing in a lot of the trainings that I have with the midwives. So what you are seeing are two midwives demonstrating just kind of like the breastfeeding talk they give mothers before going home. And so that's a big part of their job. And then the next one, what you can see is the same thing. So this is a midwife counseling. The role play was about a dad who was trying to see what the mother goes through with breastfeeding. And so she was kind of going through some of the instructions with him, but then he wanted to actually hold the baby and kind of go through that. And the other picture is just the healthcare workers and how engaged they are. One of the things that I learned through that experience, and I'll talk about all of that later, but was just how interested they were in learning more about it and being able to troubleshoot. So we will go through some case scenarios, some questions, and there's always the top 5 breastfeeding challenges that came up, regardless of which group. In the period, I've probably worked with 9 different groups, and it will be about inadequate milk supply, delayed breast milk, flat or inverted nipples, engorgement or mastitis, sore nipples, and how to navigate that. And they had different takes on what to do, but when it came to inadequate supply, there's always the talk about using different preparations, and depending on which part of Ghana that you are from. So in the north, you may use millet. This is fennel and fenugreek together, which some of the midwives will use. When there's engorgement, using shea butter as one of the ways to massage the breast. And then recently, the more introduction of hand pumps, which in of itself can be a barrier because of cost and how effective that can be. So on my most recent trip to Ghana, I went to one of the private health institutions that I had done some training a couple of years ago. And to my surprise, there was a breastfeeding cubicle, which was not there before. So I was very excited about that. And I realized that in the private health facilities, that's something that you may see, is that a lot more of them are starting to have dedicated spaces for breastfeeding, but not always like that in the public health institutions. In terms of stakeholders and policies, there's a lot of breastfeeding documents in Ghana, like policies in Ghana. And it does give you a sense of how important it is. However, the implementation and how it's implemented varies depending on whether you are in a public institution or whether you are in a private health facility. So there's more variability in the private health institutions than in the public health institutions, which in Ghana, like a public health facility, which is under the Ghana Health Service, breastfeeding is mandatory. And so there is more consistency when it comes to that than when it comes to some of the private facilities, because there's more preferences, more variability, but it also has the advantage of, spaces, maybe fathers getting more involved compared to the public health institutions where sometimes there is more like crowded space and things like that. But overall, the breastfeeding rates in Ghana has been dropping. And so exclusive breastfeeding up to 6 months has really dropped in the last decade. We are currently about 53%. And if I look back growing up, how it's almost like everybody around me when they had babies breastfed. And then now I see more of a totally different trend. In addition to that, infant feeding practices have changed quite a bit. There's a lot more mixed feeding. And so this is from the Ghana Demographic Health Survey 2022. So this is the most recent one where you are seeing, if you look at the 0 to 1 month period, there is breastfeeding, exclusive breastfeeding, maybe about 74%. But then you're still seeing mixed feeding, like breast milk and plain water, breast milk and non-milk liquids, breast milk and formula or animal milk, and then also breast milk and solids or semi-solids being introduced early. And then as the baby is growing by month, that continues to change. And so that definitely kind of goes back to the point of how much things are changing, even in a developing country like Ghana. And part of it is also how much inroads the formula industry is also making in Ghana as well. There are so many other factors that contribute to it. I think that we cannot ignore some of the drivers, like the health system itself, some of the challenges there, the fact that cultural perceptions with breast milk is also playing a role. And then in addition to that is just the socioeconomic drivers. Mothers have to get back to work early. And then the inability to even pump and store milk. I mean, if you are going to store milk, you need to have consistent electricity, which is not always available. And so those things can kind of complicate the desires that parents may have, even if they want to exclusively breastfeed. And then I got so excited when I saw that there was a new bill that was being introduced to add paternity leave. So that this year that was being considered. So Ghana has a labor law, a labor act, which was in 2000, I think was enacted in 2003. And that governs like maternity leave. And so female employees are allowed at least 12 weeks with full benefits after they've had for maternity leave. And that's 12 weeks encompasses 2 weeks before delivery up to about 10 weeks after delivery. And the new labor law that's being considered is going to push it to at least 14 weeks, plus or minus 2 weeks, depending on any abnormal confinements or if you had multiple births, additional leave for pregnancy-related illness, stillbirth, neonatal loss, or as determined by a medical doctor. So there's a little bit more leverage, more room for extended time with baby. And then during, when you return to work, mothers are being given like an hour to interrupt work to breastfeed their babies. The other new introduction was paternity leave, where within 3 months of a birth, so whether it's your wife or a surrogate or adoption of less than 1 year, fathers are being given about a minimum of 5 days, so it can be more for them to spend time with their families. So that is interesting. That is being considered. I think it's a step in the right direction. And then this slide just goes to show just how much formula is on the market in Ghana. There are so many different ones, so many like different brands. And it is definitely something that I think has gained more ground in the last, several years compared to when I was growing up, and then what I saw. So overall, just based off my interactions with healthcare workers, my own personal experiences, there's definitely the need for awareness about breastfeeding medicine and lactation services. I can't even tell you how many times I brought that discussion up in my most recent workshop last year, that, the midwives and the nurses would be like, wait, what's that? There was definitely lack of awareness, especially when it comes to physician involvement. It's always has been that community health workers and midwives have always been at the forefront of this. And so getting more physicians involved is a definite need. And then also the healthcare environment itself, like the need for education. So whether it's part of training, putting it a little bit more just besides basic breastfeeding, depending on the level that's providers are at. And then also just expertise and physician involvement is going to be important. When it comes to breastfeeding resources and support, I think the family is at the center of it, but also the role of fathers and decision makers in that unit. But at a community level, getting in more peer support, dealing with cultural perceptions. When it comes to workplace, there's definitely an opportunity for more support, lactation spaces. Some private entities have like nurseries that workers can take their babies to, which is nice. So they can actually have opportunity to breastfeed directly. And then one other resource that some of the midwives have talked about is that sometimes even having a breastfeeding helpline. So something that they can reach out to another person to have discussions around some of the challenges. When it comes to stakeholders, policymakers, I think that they are making some steps in the right direction for sure, but there's also room for consistency in breastfeeding policy, whether it's a public health facility or a private health facility with a little bit more oversight. And then legislation, personally, I think that legislation needs to extend paid maternity leave to 6 months so that they can have full benefits of it. And then tackling the predatory formula practices where it is made to show that formula, if not anything at all, is similar to breast milk or sometimes even better. And then there's also like an attached social status with it. Like I'm formula feeding, I bought this formula from the US and I'm using it, which automatically means that it's better. So just having those conversations around those. But I think that the experiences I've had have really shaped my interest in wanting to do more and hoping within the next few years to be able to partner with some breastfeeding champions in Ghana who are doing an amazing job trying to bring breastfeeding to the forefront and bring about tangible change in that area. So thank you so much. And then I'll open it up for questions.